Exposure treatment usually begins with making a list or hierarchy of situations that make the patient anxious or fearful. In addition, patients are asked to rate their level of anxiety in each situation on a scale from 0, which equals no anxiety or discomfort, to 100, extreme anxiety and discomfort. This scale is called the Subjective Units of Distress Scale, or SUDS, and patients may be asked to provide SUDS ratings at regular intervals during exposure therapy. In this practice demonstration, we will show step 3 of graded exposure therapy. Steps 1 and 2 included initial exposure with the individual, reading about snakes, and looking at photos of snakes in the therapy session as well as at home in between sessions.
Okay, Tammy, this session we're going to just follow up. Let's talk about how your homework went at home.
Well, I put the pictures that you gave me up on different parts in like my living room and kitchen and things. I wasn't comfortable putting them in my bedroom, but I put them everywhere else, so during the day I'd have to pass by them. At first I had a hard time leaving my bedroom, and actually my roommate's the one that put up all the pictures because I had a really hard time with that. But I'd say over the past week it's gotten progressively better. I go out of my room, I can stand in the kitchen and cook a meal, I can sit and watch TV. So that I think I've gotten used to the pictures for the most part.
Okay. Well, rate it like previous. How would you feel about with the pictures? How comfortable are you with them now?
Maybe a 20 or a 30. They really don't bother me that much anymore.
Okay, that's good. That's good news. So today we talked about it last week, and we're gonna have some toy snakes. We're gonna place them in different areas. How are you feeling about that?
I think it's a big difference from seeing them on a piece of paper to, I know they're not real, but it's the significance of it, I guess. I'd say my anxiety is definitely going up, maybe 50, 60.
Okay, that's okay. What I'm gonna start with is I'm gonna put a snake on the ottoman first, and then we're gonna talk about it. Okay.
Okay.
So take some deep breaths. Relax. Think of your happy place. Okay? Alright. Here's our snake. You need to look at him. Remembering that he's a toy. What kind of snake is that?
Well, from reading up on him like you asked me to do, it looks like a cobra that has a hood.
Okay. Okay. And how's that making you feel looking at him right there?
Well, he's a little intimidating. He's kind of big. And I know that they're poisonous in real life, so it's a little scary. I mean, again, knowing that it's not real, but it's still, I think, raises my anxiety a little bit, maybe 70, 80, just knowing what something like that could be capable of.
Yes. Okay. Remembering he's a toy. Alright. Take some deep breaths. How are you doing now?
Relaxing a little.
Okay. I'm going to take him down, and then I'm going to put a snake next to you. Smaller snake. A snake. Toy snake next to you, okay? I'm going to put him down so you can lose your quick focusing on him. How's that? What are your thoughts?
Well, it's much smaller.
Mm-hmm.
This one's mouth's open, so you can actually see the teeth and stuff in there. But I don't know. I don't really know what kind of snake it is.
No.
So I guess that's part of the reason why it's not so intimidating. But I don't know. It's about the same. I'm not as. The other one's more intimidating to me than this one is.
Okay. And what's your anxiety level now?
I'd almost say it's a little bit lower than with the other one. maybe 50, 60.
Okay. That's really good. You're working there. All right. So let's take some deep breaths. You look at him for a while, knowing that he's a toy. It's not going to do anything. He can't hurt you. All right. So I'm going to take him away. And now I'm going to place the snake on your lap. Okay? So just breathe and relax. You want to move the pillow? All right. It's the cobra that's coming back. Take some deep breaths. What are your thoughts?
It's kind of heavy. Makes me nauseous just having it on me.
Okay. Why do you feel nauseous? What is the nauseation coming from?
Fear.
Fear. Fear of a real cobra snake or a fake one?
Well, I know it's fake. I know it can't hurt me, but it's just I think it's my mind saying this is what it would feel like, and rationalizing it with, I know it's fake, but this would be very similar, and I know it's a very dangerous snake,
Okay.
the breed, or whatever you want to call it.
And where would you find this type of snake?
Africa maybe, different continent, and I know there's all different species of them too, all different colors.
Okay.
Yeah.
What about in the United States?
I don't think they're indigenous to the United States.
Okay.
I think the rattlesnake is the big one here for the most part.
Especially in this area.
Mm-hmm.
Okay. Rate your anxiety right now.
Well, before we started talking about it, it was through the roof. I think I was close to 100. Very nauseating and sickening. And then, I don't know, kind of talking about it and things has lowered it. I'd still have to say I'm close to 60 or 70, but, excuse me,
Feeling better.
it's getting better. Yeah.
Okay. Well, that's good work. All right. So I'm gonna take them off. I'm gonna put them over here, back over here. So next week, I'm gonna have you take these home with you, and I just want you to place them in the house and know that they're there. And we'll continue on next week, and we'll watch some videos of real snakes
Okay.
and see.
So
How
where do you
your
want me to
reaction?
put them?
Just put it on the coffee table
Okay.
or the kitchen table.
Okay.
Somewhere you're gonna walk by it,
Okay.
and I want you to rate your level each time you look at it.
Okay.
Okay?
Okay.
All right. We'll see you next week.